Slide 1, Introduction to Hematology. Good morning, everyone. Today, we will delve into the fascinating world of hematology, the study of blood and its components. Blood is a remarkable fluid that plays a vital role in sustaining life, transporting oxygen, nutrients, and waste products throughout the body. In this presentation, we will explore the guidelines for ordering hematology tests, the primary functions of blood, and the various components that make up this intricate system. We will also discuss the process of blood cell formation and the changes that occur as we age. Slide 2, Guidelines for ordering hematology tests. When it comes to ordering hematology tests, there are several guidelines to consider. First and foremost, a complete blood count, CBC, is generally included in annual blood work as a routine screening measure. However, patients with suspected diseases may show changes in their CBC, prompting further investigation. Screening for anemia is particularly crucial in groups with a high prevalence, such as women of childbearing age, the elderly, and individuals with suspected gastrointestinal bleeding. Additionally, hematology tests may be ordered for patients with tumors, infections, arthritis, or internal bleeding, as these conditions can impact blood components. Slide 3, Primary functions of blood. Blood serves several essential functions in the human body. Its primary role is to transport oxygen from the lungs to cells and tissues throughout the body. Additionally, blood facilitates the distribution of digestive products from the intestines to various organs. Blood also plays a crucial role in the transport of organ products, such as proteins, enzymes, and hormones, ensuring proper communication and regulation within the body. Furthermore, it aids in the removal of waste products from tissues and their subsequent elimination through organs like the kidneys and liver. Slide 4, Components of blood. Blood is a complex fluid composed of several components. The liquid portion, known as plasma or serum, contains various proteins, nutrients, and other dissolved substances. Plasma also contains an anticoagulant, which prevents blood from clotting within the vessels. The cellular components of blood include red blood cells, RBCs, white blood cells, WBCs, and platelets. RBCs, also known as erythrocytes, are responsible for oxygen transport. WBCs, or leukocytes, play a crucial role in the body's immune defense system. Platelets, or thrombocytes, are essential for blood clotting and wound healing. Slide 5, Blood cell formation. The process of blood cell formation, or hematopoiesis, undergoes significant changes as we age. During fetal development, organs like the spleen and liver contribute to blood cell production in addition to the bone marrow of the appendicular and axial skeleton. From birth to age 4, most blood cell production takes place in the marrow of most bones, with some contribution from the liver and spleen. Between ages 4 and 18, production becomes increasingly concentrated in the axial skeleton's bone marrow. From age 18 through adulthood, blood cell production occurs primarily in the axial skeleton's bone marrow, with the spleen and liver playing a diminished role. Slide 6, Red blood cell production, erythropoiesis. Red blood cell production, or erythropoiesis, is a complex process regulated by various factors. Erythropoietin, EPO, a hormone released by the kidneys, is triggered by low oxygen levels in the blood and stimulates red blood cell production in the bone marrow. Erythropoiesis requires essential nutrients such as iron, folate, vitamin B12, and protein. During this process, the immature red blood cell precursor undergoes several stages of maturation, including the ejection of its nucleus and ribosomes, and the formation of hemoglobin, a pigment protein responsible for oxygen transport. Immature red blood cells, or reticulocytes, are larger and may contain nuclear material. Mature red blood cells are composed primarily of hemoglobin and have a lifespan of approximately 120 days, after which they are removed from circulation by the spleen. Slide 7, Erythropoiesis, RBC production and maturation. The process of erythropoiesis begins with a pluripotent hematopoietic stem cell, which differentiates into various blood cell lineages. As the cell progresses through different stages, it loses its nucleus, some organelles, and eventually, its remaining organelles. The stages of red blood cell maturation include the proerythroblast, also known as a normoblast, basophilic erythroblast, polychromatophilic erythroblast, and orthochromatic erythroblast. The final stage is the mature erythrocyte, or red blood cell, which has a lifespan of approximately 120 days. Reticulocytes, which represent about 1% of circulating red blood cells, are immature red blood cells that typically spend 3 days in the marrow and 1 day in the bloodstream before maturing into erythrocytes. Slide 8. Cell development. Cell development in the bone marrow begins with stem cells, which are found in the marrow's specialized microenvironment. These stem cells undergo differentiation in response to various stresses and chemical signals, giving rise to different blood cell lineages. Under certain conditions, such as stress or disease, the bone marrow may release immature cells into the circulation. It is important to note that the bone marrow produces approximately 2 million red blood cells per second, and at any given time, there are around 25 to 35 trillion red blood cells in circulation. If there is a deficiency or absence of stem cells, it can lead to a decrease or absence of cellular elements in the blood, affecting the production of various blood cell types. Slide 9. Complete blood count with differential. The complete blood count, CBC, with differential is a comprehensive test that provides valuable information about the various components of the blood. It includes the following parameters. 1. Red blood cell count, RBC2. Hemoglobin, HGB3. Hematocrit, HCT4. Mean corpuscular volume, MCV5. Mean corpuscular hemoglobin, MCH6. Mean corpuscular hemoglobin concentration, MCHC7. Red blood cell distribution width, RDW8. White blood cell count and differential, WBC9. Blood smear evaluation. 10. Platelet count. 11. Mean platelet volume, MPV. The CBC with differential provides a comprehensive overview of the various blood cell types, their morphology, and any abnormalities that may be present. Slide 10. Blood smear evaluation. The blood smear evaluation is an essential component of the complete blood count. It involves examining the blood sample under a microscope at both low and high magnifications. At low magnification, the smear and stain quality are evaluated, and the distribution of cell types is assessed. Additionally, the number of white blood cells may be estimated, and rare or abnormal cells may be detected for further examination at high magnification. Under high magnification, the morphology of individual red blood cells, white blood cells, and platelets is carefully examined. Platelet numbers may be estimated, and a white blood cell differential count may be performed to determine the relative proportions of different white blood cell types. Slide 11. Blood smear, things to note. When evaluating a blood smear, there are several important morphological features to note. 1. Anisocytosis, unequal size of red blood cells. 2. Poikilocytosis, presence of abnormal red blood cell shapes, greater than 10% of the population. 3. Polychromatophilia, presence of reticulocytes after applying certain dyes. 4. Basophilic stippling, blue specks within red blood cells, indicative of lead poisoning. 5. Target cells, red blood cells with a lump of hemoglobin, often seen in thalassemia. 6. Schistocytes, fragmented red blood cells, seen in conditions like thrombotic thrombocytopenic purpura, TTP7. Howell-Jolly bodies, nuclear inclusions in red blood cells, observed in patients with a damaged or absent spleen, or functional asplenia. Recognizing these morphological features on a blood smear can provide valuable insights into various hematological disorders and guide further diagnostic procedures. Slide 12. Red blood cell testing. In this section, we will focus specifically on red blood cell testing and its importance in the evaluation of anemias. Anemias are characterized by a reduction in the number of red blood cells, hemoglobin concentration, or both, resulting in impaired oxygen delivery to tissues. Red blood cell testing plays a crucial role in diagnosing and monitoring anemias, as well as understanding their underlying causes. Slide 13. RBC laboratory testing. Red blood cell laboratory testing includes the following measurements and calculations. 1. RBC, the number of red blood cells per unit volume of blood. 2. Reticulocyte count, the number of immature red blood cells, indicating the bone marrow's response to anemia. 3. Hemoglobin, HB, the mass of hemoglobin in the whole blood sample. 4. Hematocrit, HCT, the percentage of the blood volume occupied by red blood cells. 5. Mean corpuscular volume, MCV, the average volume or size of a single red blood cell. 6. Mean corpuscular hemoglobin, MCH, the average amount of hemoglobin inside a single red blood cell. 7. Mean corpuscular hemoglobin concentration, MCHC, the average concentration of hemoglobin inside a volume of red blood cells. 8. Red blood cell distribution width, RDW, a measure of the variation in the size of red blood cells, anisocytosis. These measurements and calculations provide valuable information about the quantity, size, hemoglobin content, and distribution of red blood cells, aiding in the diagnosis and management of various anemias and other hematological disorders. Slide 14, Red blood cell count, RBC. The red blood cell count, or RBC, measures the number of red blood cells per unit volume of blood. Changes in the RBC count can indicate various conditions. Increased RBC count. Dehydration, relative increase, chronic obstructive pulmonary disease, COPD, or congenital heart disease, absolute increase due to low oxygen states, renal cell carcinoma, paraneoplastic erythropoietin overproduction, polycythemia vera, a myeloproliferative condition. Decreased RBC count. Blood loss, acute or chronic, hemoglobinopathies, for example, sickle cell disease, thalassemia, bone marrow disorders, for example, leukemia, multiple myeloma, lymphoma, kidney failure, decreased erythropoietin production, nutritional deficiency anemias, iron, vitamin B12, folate. The normal range for RBC count is 4.5 to 6 million/microliter in males and 4 to 5 million/microliter in females. Slide 15, Reticulocyte count. The reticulocyte count measures the number of new, immature red blood cells found in the circulation. These cells are larger than mature red blood cells and contain remnants of ribosomes and other cellular material. Reticulocytes appear in the circulation when there is an acute decrease in the number of red blood cells, indicating the bone marrow's response to anemia. The reticulocyte count is reported as a percentage of the total red blood cell count. A high reticulocyte count suggests an increased production of red blood cells by the bone marrow, which can occur in various conditions such as hemolytic anemias, blood loss, or after treatment for certain types of anemia. It is important to note that the reticulocyte count cannot be low, as these cells are not normally present in significant numbers in the circulation. Slide 16, Hemoglobin, HB. Hemoglobin is the iron-containing pigment protein found within red blood cells that is responsible for oxygen transport. The hemoglobin measurement reflects the mass of hemoglobin in a volume of whole blood. A low hemoglobin level indicates a reduced oxygen-carrying capacity of the red blood cells, which can result in tissue hypoxia, low oxygen levels. Each red blood cell contains approximately 250 million hemoglobin molecules, with each molecule capable of carrying 4 oxygen molecules. Hemoglobin is composed of 4 subunits, 2 alpha and 2 beta chains, and its red color is due to the presence of iron. It transports oxygen from areas of high concentration, such as the lungs, to areas of low concentration, tissues, through the binding and release of oxygen molecules. Slide 17, Hematocrit. The hematocrit is a measure of the percentage of whole blood volume that is comprised of red blood cells. It is calculated as the ratio of the packed volume of red blood cells to the total volume of the blood sample. Normal hematocrit values range from 37% to 47% in males and 42% to 52% in females. A depressed hematocrit percentage is indicative of anemia, while an elevated hematocrit percentage may suggest a condition called polycythemia, characterized by an excessive production of red blood cells. The hematocrit value reflects the amount of packed red blood cells, or the solid portion of the blood, contained within the body. It provides important information about the oxygen-carrying capacity of the blood and can aid in the diagnosis and monitoring of various hematological conditions. Slide 18, Weintraub indices, calculated values. The Weintraub indices are a set of calculated values that provide additional insights into the characteristics of red blood cells. These indices include 1. Mean corpuscular volume, MCV2. Mean corpuscular hemoglobin, MCH3. Mean corpuscular hemoglobin concentration, MCHC. The Weintraub indices are derived from the measurements of hemoglobin, hematocrit, and red blood cell count. They are useful in classifying anemias based on the size, MCV, and hemoglobin content, MCH and MCHC, of red blood cells, aiding in the differential diagnosis of various hematological disorders. Slide 19, Mean corpuscular volume, MCV. The mean corpuscular volume, MCV, is a measurement of the average volume or size of a single red blood cell. It is calculated by dividing the hematocrit by the red blood cell count. A low MCV value indicates microcytic red blood cells, which are smaller than normal. This condition is often associated with iron deficiency anemia or thalassemia. A high MCV value suggests macrocytic red blood cells, which are larger than normal. This can be seen in conditions such as vitamin B12 or folate deficiency, as well as certain anemias and liver diseases. A normal MCV value indicates normocytic red blood cells, which are of average size. Slide 20, Mean Corpuscular Hemoglobin, MCH. The mean corpuscular hemoglobin, MCH, is a calculation of the average amount of hemoglobin inside a single red blood cell. It is derived by dividing the hemoglobin concentration by the red blood cell count. Since the amount of hemoglobin contributes to the color or pigmentation of the red blood cell, the MCH value is used to define the chroma or pigment of the cell. A low MCH value indicates hypochromic red blood cells, which have a lower than normal hemoglobin content. This condition is often associated with iron deficiency anemia or thalassemia. A high MCH value usually corresponds with an increased MCV and, therefore, a macrocytic condition, such as vitamin B12 or folate deficiency anemia. A normal MCH value suggests normochromic red blood cells, which have a normal hemoglobin content. Slide 21, Mean Corpuscular Hemoglobin Concentration, MCHC. The mean corpuscular hemoglobin concentration, MCHC, is a calculation of the average concentration of hemoglobin inside a volume of red blood cells. It is derived by dividing the hemoglobin concentration by the hematocrit value. The MCHC indicates how fully the red blood cells are filled with hemoglobin and is related to the MCH value. It provides information about the density of hemoglobin within the red blood cells. A low MCHC value suggests hypochromic and/or microcytic red blood cells, which are often seen in iron deficiency anemia or thalassemia. A normal MCHC value indicates normochromic red blood cells, with a normal hemoglobin concentration. The average MCHC value is approximately 15 grams per deciliter in males and 13 grams per deciliter in females. Slide 22, Red Cell Distribution Width, RDW. The red cell distribution width, RDW, is a measurement of the variation in the sizes of red blood cells, also known as anisocytosis. A lower RDW percentage indicates that the sizes of the red blood cells are more uniform, while a higher RDW percentage suggests a greater variation in cell sizes. Slide 22, Red Cell Distribution Width, RDW. An increased RDW can be seen in conditions such as iron deficiency anemia, vitamin B12 or folate deficiency anemia, hemoglobinopathies like sickle cell disease, or in cases of fragmentation of red blood cells due to trauma or certain disorders like thrombotic thrombocytopenic purpura, TTP. A high RDW value indicates a greater degree of anisocytosis, or variation in the size of red blood cells, suggesting a mixed population of cells with different sizes and ages. This can occur when the bone marrow is releasing a diverse range of red blood cells in response to various stresses or deficiencies. Slide 23, Summary. In summary, we have covered the essential aspects of red blood cell testing and its significance in the evaluation of anemias and other hematological disorders. The key measurements and calculations we discussed include 1. RBC count, cells per volume sample. 2. Hemoglobin, HB, weight/mass of hemoglobin per volume sample. 3. Hematocrit, HCT, volume of all cells/volume of sample. 4. Mean corpuscular volume, MCV, average size of a cell, HCT/RBC5. Mean corpuscular hemoglobin, MCH, average weight/mass of hemoglobin per cell, HB/RBC6. Mean corpuscular hemoglobin concentration, MCHC, average density of hemoglobin per cell, HB/HCT7. Red cell distribution width, RDW, degree of variation in red blood cell sizes. By interpreting these parameters, healthcare professionals can gain valuable insights into the quantity, size, hemoglobin content, and distribution of red blood cells, aiding in the diagnosis and management of various hematological conditions, particularly anemias. Remember, a thorough understanding of red blood cell testing and its implications is crucial for accurate diagnosis and effective treatment of hematological disorders.